Walden Behavioral Health Agency has been operating in St. Mary's County since 1973. It provides treatment for addiction and substance abuse, counseling and assistance for victims of domestic violence and other trauma, and a 24-hour professionally staffed crisis intervention hotline.
We began as a very small hotline and substance abuse program in the woods on St. Andrew's Church Road, and have been answering that hotline and responding to the changing needs of St. Mary's County for the last 35 years.
It was named for the classic literary work by 19th century American author Henry David Thoreau, whose memoir of living in solitude in the woods of Walden Pond in Massachusetts echoed the mission of the program's founders to help people find peace in times of turmoil.
I went into the woods because I wished to live deliberately, to front only the essential facts of life.
For us, it was the idea of a sanctuary and to get a time to focus on their lives and to get a chance to really refocus and learn the skills they needed to continue on the journey of life. And as we've responded to those calls, we've built programs to address those issues that are of concern to the community.
Those programs have since grown to include a substance abuse treatment program that offers a residential treatment facility called Anchor, a halfway house called Compass, outpatient counseling, and public awareness programs. Also, domestic violence and sexual assault services, including transportation and shelter for people in emergency situations, individual and group counseling, support groups for parents and children coping with divorce, and the hotline that started it all, now one of the longest operating professionally staffed hotlines in the United States.
We respond to hundreds of calls a month, thousands a year, and they range from the child who's afraid to go home with their bad report card to a person who's suicidal and is in imminent danger. And we see all of them as significant because a crisis really is what it is to that person.
I would say one of the most challenging cases would have to do with probably domestic violence, because what you have to do is work with the client, like again, I'll say she for all intents and purposes, work where she's at, because sometimes she's calling and the abuser just left the home. And so she's calling at that time that she has to say, you know what, I need to get out of here. What can I do? A lot of the women don't have transportation. If they do, limited gas. They may not be employed. And then if they have children, we have to look into that. And so we try to, orchestrate getting them from the home and to a shelter. And so that's extremely difficult.
The hotline operates 24 hours a day and is staffed with counselors who are trained in crisis techniques, some of whom have master's level degrees in psychology, social work, and other disciplines. Hotline staffers work to assess the caller's immediate situation, help them stabilize the situation, and then offer options for long-term assistance with the caller's particular issue. One option is to come in and talk with an on-site counselor.
They can come in for an appointment either the same day or, we try to get them in within that week. We offer individual counseling for anyone who has experienced domestic violence or sexual assault, and that includes children or someone who was molested as a child.
There is also a variety of group counseling services Walden offers.
We also offer groups for perpetrators of domestic violence, and then we have anger management groups as well, which are co-ed. We have group counseling for women who have experienced domestic violence, and then also a group for children who've experienced domestic violence. So we cover a wide range, and also those who, like teenagers, we have a teen group, and that deals with social skills and other things they might be dealing with during their adolescent years.
For families that are experiencing divorce, there is a group called Roller Coasters that helps kids deal with their new situation. And there's a group for adults called co-parenting.
Meaning that even though the parents are living in separate homes now, they can still work together or cooperatively to raise the child. And so it teaches parents ways to work together and not allow their issues to get in the way of raising their child.
If Walden does not provide the specific service a caller needs, the hotline will refer that person to a local agency that can give the caller the appropriate assistance.
I like working with people, but then I also like helping people. There's a lot of people who are suffering in this world, and I want to be there to help.
I picked up the my messages this morning, and there was one such person who said that they had reached out to our hotline, and our hotline worker had saved their life, and they just wanted me to know that this hotline worker had made all the difference. The hotline has been our teacher. It's taught us what's needed, it's taught us what programs we need, and it's taught us what kind of help is needed in the community.
A result of that learning process is Walden's variety of substance abuse treatment programs, which are provided on either an inpatient or outpatient basis. Clients who are dealing with a substance abuse problem can attend education and support groups that meet from 1 hour a week to several hours a week, depending on the severity of their addiction. If an individual needs more intense treatment, Walden's Anchor facility in Charlotte Hall provides a residential program built to accommodate individualized needs.
We detox here. We have nurses around the clock and physicians assistants that come in and monitor a person's detox as well. Because the goal is to get the person through a withdrawal process safely, medically safely, and carefully, that they're not sick through the whole process. But it's painful. It's not just a physical thing, it's an emotional thing as well. So we have to attend to all those needs at the same time.
After the detox process is complete, the clients begin the behavioral program, where, in addition to individual counseling, they take part in group sessions that help with such things as processing their thoughts and feelings, practicing strategies for dealing with difficult situations, and learning to recognize the things that trigger their impulse to use a substance.
Having a lot of people in the facility at one time with different backgrounds, the thing that they all have in common is the addictive illness. They can really call each other up on negative behavior, on inappropriate thinking, on poor decision making, and it's really very helpful to have somebody else say, hey, I know that, I've been there, I've done that, and you're doing what I did. You're acting the way I used to act. You're responding the way I used to respond. So it's really good to have people who understand the pain and the suffering of the illness coming together and saying, I know where you are, I know where you've been, and I know I can get out, and we can get out of this bad place.
Anchor provides its residents with meditation and exercise programs, including Tai Chi. It tends to their nutrition and dietary habits, and even provides education and counseling for the families of clients.
We deal with so much. The emotional person, the spiritual person, and the medical components. We use a holistic concept, which is body, mind, and soul. We have to address all those pieces. Our primary goal here is to stabilize the person. So, it's stabilizing the individual, it's developing a plan that's specific to that individual. It's not a one-size-fits-all kind of process here.
For some women recovering from substance abuse, the recovery plan involves a stay at Compass, where women, including mothers and expectant mothers, can live with their children for 6 to 9 months while they develop or relearn the life skills that will help them remain substance-free.
Basically, for example, some of the coursework would be parenting coursework, how to be a good parent, life skills. If you're employed, or when you're employed, and most people are employed at the program, then how to balance a checkbook, the difference, simple things that we take for granted. If someone's not used to saving money, how do you really budget? How do you shop? How do you make it on an income that's a fixed income? How do you set aside a certain part of your, we charge a modest fee for rent, but that's to get the discipline of setting aside a certain amount of money every month in a budgeted format, and things of that nature.
Once the recovering individual is living independently again, he or she can continue to attend support groups aimed at managing the chronic nature of addictive disease and preventing relapses.
It's just providing them with support to deal with things like financial difficulties, to get themselves through legal hurdles, get themselves through parole and probation, making sure that they are attending, whatever meetings they need to attend out in the community. The 12-step programs, we stress that. They're getting a sponsor in those 12-step programs so they have someone to act as a guide for them. And a lot of them experience emotional fluctuations. One day they're up, the next day they're down. And it's just learning how to manage emotions. That's part of what goes on in recovery. We call it post-acute withdrawal. And post-acute withdrawal is a variety of symptoms that happen to the individual as their brain chemistry returns to normal after they've been using chemicals for so many years.
Walden also participates in education programs, working with the local schools and with the court system to help people avoid developing serious drug problems in the first place.
A program of which I'm very proud is a community collaborative effort between many of the service agencies in the St. Mary's County, and that is the St. Mary's County Juvenile Drug Court.
Adolescents with a history of drug use and nonviolent illegal activity are referred to the program by the Department of Juvenile Services. After it's determined what special services he or she might need, such as tutoring or psychiatric care, the juvenile client is assigned a case manager.
And they're very proactive by going to the kid's house. They communicate with the family as a whole. They'll go to the house and do spot urinalysis checks. They have curfew checks. And the sheriff's department usually participates in riding around with the case managers from juvenile services to check up on these kids and make sure they're where they're supposed to be when they're supposed to be there. So it's pretty intense, and they kind of live in these kids' back pocket, if you will, to make sure they're compliant with the program.
The answers are really within the community and within the people that we serve, and we facilitate that. And when we say that we're community-based, we truly are. We have partnerships with agencies throughout the community. We have staff who are located in other agencies. We have staff located in our school system, as well as partnerships with our judicial system and the detention center. Walden is funded with a patchwork of sources. We have several grants from the state, from the Department of Health and Mental Hygiene and the Department of Human Resources. We have a grant from the county government for our crisis program, so they fully fund our crisis services. We also have foundation grants to support some of those services that are underfunded, as well as donations. We're a United Way organization, and that's been a tremendous asset for us. We are nationally accredited through CARF, which is a national accrediting body, so that we uphold the highest quality of service. We find that we really strive to have the highest standard of care for the citizens of St. Mary's because they deserve it.
Walden has offices in Lexington Park and California, as well as its Anchor facility office in Charlotte Hall. Volunteers and contributors are always welcome. Walden also facilitates a Friends and Alumni Network for those seeking recovery and for their family members and friends. The phone number for general information is 301-997-1300. The 24-hour hotline number is 301-863-6661. And more information is available on its website, waldensierra.org.
Go confidently in the direction of your dreams. Live the life you've imagined.
We had a young girl who came to us and had a desperate experience that she had been prostituted at the age of 8. She unfortunately succumbed to AIDS. But one of the things that she really said to me that has stayed with me for all these years, and when those tough days come, she gave me a little sign that says, "For a moment in time." And it was a Hershey kiss, and she said, you know, she felt that she had experienced love. Now, she's a success story for me. She didn't make it, but she's made it possible for many others to make it, because it's that courage that she had against all adversity that has kind of said to me, you know, how fortunate we are to be in the midst of some of these people, because I don't know that I could have the courage that that young girl had. The courage that it takes when you're at your lowest to pick up the phone or to come through the door and say, I do need help. And it's a lesson for all of us, because there's times when we all need help.